The sleeping position most often linked with worse nighttime breathing is lying flat on your back. But that position does not directly cause a stroke in most people. The real concern is what may happen to the airway while a person is sleeping. I'm Catherine Blake, and I want to separate a useful health warning from an alarming headline. Back sleeping can make obstructive sleep apnea worse in some people. Untreated sleep apnea is associated with high blood pressure, irregular heart rhythms, heart disease, and stroke. However, simply turning onto one side has not been proven to prevent a stroke. The hidden danger is repeated airway blockage. During sleep, the tongue and soft tissues relax. In certain people, they fall backward and narrow the throat, especially when the person lies face up. Breathing may stop for several seconds, oxygen falls, and the brain briefly wakes the body to reopen the airway. This cycle can happen dozens of times an hour without the sleeper remembering it. Think of the airway as a soft drinking straw. When the straw is upright, air may pass freely. When it bends and pressure builds around it, the sides can collapse. Each time the airway closes, the heart and blood vessels must respond to a small emergency. Consider a man of 66 who believes he sleeps well because he spends 8 hours in bed. His wife notices loud snoring, pauses in breathing, and sudden gasps. He wakes with a dry mouth and headache, then feels sleepy after lunch. He assumes this is normal aging. During a routine visit, his blood pressure is much higher than expected. A sleep study later shows severe obstructive sleep apnea, especially when he lies on his back. The important discovery is not that his pillow or mattress was causing a stroke. His position was revealing and worsening a breathing disorder that needed proper treatment. Today, I'll explain 7 parts of this nighttime risk: back sleeping, side sleeping, hidden apnea symptoms, alcohol and sedatives, blood pressure surges, proper treatment, and the stroke signs that require immediate action. First, let us look more closely at sleeping on the back. Many people assume that lying face up is automatically the healthiest position because the spine appears straight. For someone without sleep apnea, it may be perfectly comfortable and safe. The concern applies mainly to people whose airway becomes more blocked in that position. Gravity can pull the tongue and soft palate toward the back of the throat. Air then has to squeeze through a smaller opening, like traffic entering a road where several lanes have suddenly closed. Snoring may become louder, and complete breathing pauses may become more frequent. The National Heart, Lung, and Blood Institute explains that the tongue can fall backward and block the upper airway. If you snore heavily, gasp during sleep, or have diagnosed positional sleep apnea, ask your clinician whether avoiding back sleeping should be part of your plan. A body pillow or positional device may help you remain on your side, but it should not replace prescribed treatment. The second part is side sleeping. People sometimes hear that everyone should sleep on one particular side to protect the heart or brain. The truth is more balanced. There is no single side that guarantees stroke protection. For many people with positional obstructive sleep apnea, either side can help keep the airway more open than lying flat on the back. Imagine opening a folded garden hose. Changing its angle may improve the flow, but it does not repair every cause of narrowing. The NHLBI's sleep apnea treatment guidance notes that a healthcare provider may recommend side sleeping because it can help keep the airway open. Try a comfortable side with the neck in a neutral position. Avoid stacking the head on several high pillows, which may bend the neck sharply. People with shoulder problems, severe reflux, pregnancy-related concerns, or other medical conditions may need personalized advice. But this is where the issue becomes more serious. Position matters less than recognizing the signs of sleep apnea itself. The third part is hidden nighttime breathing trouble. Many people think sleep apnea always means loud snoring in an overweight man. Snoring is common, but some people with apnea snore only lightly, and some do not realize they snore at all. Women and older adults may mainly notice fatigue, morning headaches, poor concentration, insomnia, or frequent nighttime urination. During an apnea episode, oxygen can fall while carbon dioxide rises. The brain responds like a smoke alarm, briefly pulling the body out of deeper sleep so breathing can restart. The sleeper may not become fully conscious, but the normal sleep cycle is broken repeatedly. Watch for loud, irregular snoring, choking, witnessed breathing pauses, morning dry mouth, morning headaches, unexplained daytime sleepiness, and blood pressure that remains difficult to control. A phone recording or smartwatch cannot confirm or rule out sleep apnea. A clinician may recommend a home sleep apnea test or an overnight study. If you plan to pay closer attention to these signs, comment yes. That small commitment may help you discuss symptoms that have been ignored for years. The fourth part is alcohol and sedating substances. People often use alcohol as a sleep aid because it can make them feel drowsy. It may help someone fall asleep faster, but it can relax the throat muscles, worsen snoring, increase airway collapse, and disturb the second half of the night. Picture the throat muscles as the supports holding open a soft tunnel. Alcohol loosens those supports. In a person already vulnerable to obstruction, the tunnel may close more easily. Some sleeping medicines, opioid pain medicines, and other sedating drugs can also affect breathing. Avoid using alcohol as a treatment for poor sleep, especially close to bedtime. Never stop a prescribed medicine suddenly, but ask the prescribing clinician whether it could worsen snoring, breathing pauses, or daytime sleepiness. Combining alcohol with sedating medication can be particularly dangerous. The fifth part is the strain placed on the cardiovascular system. People may believe that breathing pauses only reduce sleep quality. In reality, every pause can trigger changes in oxygen level, heart rate, and blood pressure. It is like repeatedly pressing the accelerator and brake while a car is climbing a hill. The system never settles into a smooth rhythm. Over time, untreated sleep apnea may contribute to difficult-to-control hypertension and may be linked with atrial fibrillation, a heart rhythm that can allow clots to form. The NHLBI lists stroke, atrial fibrillation, atherosclerosis, and high blood pressure among the conditions associated with untreated sleep apnea. This does not mean every person who snores will have a stroke. It means persistent breathing disruption deserves evaluation, especially when combined with high blood pressure, diabetes, smoking, high cholesterol, or previous heart disease. Check your blood pressure regularly if your clinician recommends it. Take prescribed blood pressure and heart medicines consistently. Sleep position cannot cancel the effects of uncontrolled blood pressure or an untreated irregular heartbeat. The sixth part is proper apnea treatment. Some people believe side sleeping is enough for every case. Positional therapy may help when breathing events mainly occur on the back, but moderate or severe apnea often requires more. A continuous positive airway pressure machine, or CPAP, works like a gentle air splint. It supplies enough pressure to prevent the soft airway from collapsing. Other options may include an oral device, weight management, treatment of nasal obstruction, or selected surgical procedures. The right choice depends on the cause and severity of the condition. Do not abandon CPAP simply because side sleeping seems to reduce snoring. Snoring volume does not show what the oxygen level is doing. If a mask leaks, feels uncomfortable, or causes dryness, ask the sleep clinic about adjustments. Different masks, humidity settings, and pressure changes can make treatment easier. A magnesium supplement may support normal nerve and muscle function, and it may help sleep in some people whose intake is low. However, it cannot hold a collapsing airway open or treat sleep apnea. Consult a doctor before using it, particularly if you have kidney disease or take regular medication. The seventh part is what to do when a possible stroke is discovered after sleep. Some strokes begin during the night, and the person wakes with symptoms. The sleeping position may receive the blame, but the immediate priority is emergency care. Remember FAST. F is for facial drooping. A is for arm weakness. S is for speech that is slurred, confused, or suddenly difficult. T is for time to call emergency services. Also watch for sudden vision loss, severe imbalance, one-sided numbness, confusion, or an unusually severe headache. The brain depends on blood flow like a house depends on electricity. When a vessel is blocked or breaks, brain cells can lose their supply quickly. Do not wait for symptoms to improve. Do not go back to sleep. Do not take aspirin unless emergency professionals instruct you, because some strokes involve bleeding. Call your local emergency number and report the time the person was last known to be normal. If symptoms are noticed upon waking, that may be the time they went to sleep. Modern hospital imaging can sometimes identify people who may still benefit from treatment, so never assume that waking with symptoms means it is too late. Now you know the central truth. Back sleeping is not a direct or universal cause of stroke. It can worsen obstructive sleep apnea in certain people, and untreated apnea is associated with conditions that increase cardiovascular and stroke risk. Side sleeping may improve breathing in positional apnea, but it is not a substitute for diagnosis, blood pressure control, or prescribed treatment. The American Heart Association notes that avoiding face-up sleep can modestly reduce apnea severity in some people, while evidence has not established that position changes alone prevent stroke. Your action step tonight is simple. Notice whether there is loud snoring, gasping, breathing pauses, morning headache, or unusual daytime sleepiness. If those signs are present, arrange a medical evaluation rather than relying only on a new pillow or sleeping position. If you already use CPAP, continue using it as prescribed. Subscribe for more calm, practical health guidance. Comment with the nighttime sign you will remember, and share this with someone who thinks persistent snoring is harmless.